Hi, it's your man DB again, and today I want to speak about one of the most commonest problem we deal with in our day-to-day lives. That is headache. There are so many different types of headache, but I choose to talk about just the three. That is tension headache, cluster headache, and migraine. What is this tension headache? Tension headache is the commonest type of headache that we experience in our daily activities. Tension headache has a bilateral sense of appearance. That is, you will feel it on both sides of your head, and it has a tightening, a very pressing and dull aching appearance on both sides of your head. Tension headache intensity ranges from mild to moderate. It doesn't stay for long, and the duration, it's only about 30 minutes to 1 hour. What causes this tension headache? Most of the tension headache that we experience in our daily activities is due to lack of proper sleep, lack of too much stress, too much work, too much homework for school kids and college. And then again, tension headache treatment tension headache will never ever hinders you from doing your daily activities. That is, you can have tension headache and go about your business. And the treatment for tension headache, as I mentioned earlier, you just have to have a proper rest, a proper sleep, and if it does not subside, you can take over-the-counter drugs like paracetamol, Panadol, and NSAIDs. Okay, coming to cluster headache. From the name, you know this ain't gonna be good. So cluster headache is a very severe unilateral type of headache. It has a very variable amount of symptoms and attack. An attack of cluster headache can ranges from 1 attack in every 2 days up to 8 attacks in a day. And a patient can have a symptoms of pain in one eye, and it has a sudden onset of appearance, also a sudden onset of disappearance. Other associated symptoms of cluster headache can be a constricted pupil, a watery eye, a watery nose, that is rhinorrhea. It can have a drooling of eyelid. It kind of like mimic migraine, but it's not migraine. And it can have also a photophobia. And if you experience a cluster headache for the first time especially, you have to consult your physician because they have to rule out other causes of headache. And now the duration of cluster headache, it's only 15 minutes to 3 hours. And once somebody has a cluster headache, you will know they have a cluster headache because they will be restless, they cannot do their daily activities. The management of cluster headache is mostly simple: 100% oxygen, the triptans. The prophylaxis of cluster headache is mostly calcium channel blockers. And like I mentioned earlier, cluster headache should not be treated ideally on your own. You have to consult a physician or you have to go to the nearest ER. Thank you.